Hi, everyone, and welcome to today's webinar titled Harm Reduction Strategies for Emerging Adults Cannabis Use. My name is Kendra Ostermeyer, and I'm a graduate assistant with Illinois Higher Education Center. I work with Annabelle, the assistant director of IHEC. And on behalf of the IHEC staff, we are excited to be hosting today's event. Before I hand over the microphone, I have a few housekeeping items to cover about today's webinar. For those that have questions, we encourage you to ask. All attendees will be muted for the duration of the presentation. If the speaker allows room for questions, please feel free to participate. Otherwise, just keep your commentary or questions in the chat and we can address them at the end. I want to introduce today's speaker, Joe Eberstein. He works for the Center for Community Research Incorporation, where he is the Director of Community Engagement. He is a certified prevention specialist and a national speaker regarding youth cannabis use. His role includes raising awareness regarding the effects of marijuana on youth and developing regional prevention strategies to reduce use and access. So without further ado, I'll pass things over to him.
Thank you so much, Kendra. Good morning, everybody. I am in San Diego. It's not so sunny right now. Thank you for joining me. I'm excited about today's presentation. Let me share my screen. So I think I need to be co-host, Kendra.
Okay, hold on just a second.
Okay. Okay. Here we go. Okay, so as Kendra said, I am the program manager for the Cannabis Public Health Initiative in San Diego. And today's a little bit of a change for me, talking about harm reduction strategies for emerging adult cannabis use. Both of us in Illinois and California have retail cannabis, so it is important to meet people where they're at. So let's get started. I am with the Center for Community Research. It's a 501c3 nonprofit. And this year we're celebrating our 15-year anniversary serving in the community. I still go out there in the community. I do a lot of primary prevention. I have lived experience and we try to hire staff with lived experience as well. So it's important that we learn about cannabis because it looks like probably in another 5 years, every state is going to have some sort of either legal, fully legal, or retail cannabis access. And you can see here, and I've watched this map change over the years, fully legal is in green, orange is fully illegal, and then the bluish color is sort of a mixed bag of allowing medical use, allowing CBD, but I have a feeling that those mixed are going to eventually turn green. One of the reasons is this is a multi-billion-dollar industry. Just to give you a number, in 2023, the cannabis industry just in California generated $1 billion of tax revenue for the state of California. Now ask yourselves, how much has prevention brought in? Unfortunately, it's not the same. So in some cases, prevention is taking a backseat to the industry. It is important for us to understand why people use cannabis. Being that I work directly with people, I also work with kids at schools. I've come up with about 4 ideas. And one is that the harm perception is really low around cannabis, probably the lowest in history right now. It's unfortunate because we have the highest potency products right now as well. They like the psychoactive effect of being high. Or with CBD, they like the sedative effect. They use it for medical reasons, and I'll get into that a little bit. Some of them are dependent. You know, cannabis along with tobacco and alcohol are often the first substances that young people use. And that usually starts from the data we have around 11 or 12 years old. Now, if we're reaching young people in college, that means, you know, they've been smoking probably 10 years. I have parents that will come up to me and say, you know, hey, listen, can you talk to my son and tell him not to use marijuana? I said, how old is your son? You know, 19? 19, he's probably been using for 7 years. There's no way I'm going to be able to talk him out of being dependent. So he might need some sort of a program. So I do a lot of primary prevention. And what is primary prevention? Well, it's working with those young kids to try to keep them from ever using. I'm a big proponent of this. So I don't want people to think, well, you're doing a harm reduction presentation, you're not a proponent of primary prevention. I am, and I believe we can use all the tools in the toolbox, which is what we should, to help people. You know, I have to oftentimes remind my prevention counterparts that we want to keep people alive, you know. So we can't judge, you know, we have to meet people where they are. But what are some primary prevention strategies? Education, creating barriers to access, advertising restrictions, limiting density and age limits. Now, for those individuals who use in spite of primary prevention efforts, what do you do now? Well, there's harm reduction. What's harm reduction? Engaging people who use drugs and equipping them with life-saving tools and information to create positive change. Harm reduction emphasizes engaging directly with people who use drugs to prevent overdose and infectious disease transmission, improve physical, mental, and social well-being, and offer low-barrier options for access to healthcare. Again, we can use all of the tools in our toolbox to keep people alive and healthy. I want to go over some college-level data about cannabis use. Cannabis use has increased among college-age Americans, especially in states that legalize recreational use. This is a study out of Oregon. I know it says the Washington State Standard, but it's a study out of Oregon. In 2020, about 20% of young adults believe regular cannabis use would be harmful, compared with nearly 60% 2 decades ago. So there's that harm perception that has really dwindled down. Frequent use has increased, defined as using 20 or more times in the past 30 days. And this is something that's a little different than our 12 to 17-year-olds, is the frequency of use for college-age youth. They use a lot more in the past 30 days than our younger kids. Some more data about colleges and use. Annual cannabis use has continued to increase over the past 5 years for college students, reaching the highest level in over 3.5 decades in 2020. Now, in 2020, we had the lockdown, and what we're seeing in a lot of the data is either a leveling off or a decreasing of substance use. This goes for 12 to 17-year-olds, and it also goes for the college-age youth, according to Monitoring the Future surveys and our California Healthy Kids survey. But among those college students who do use, 12% who had ever used cannabis has used it daily or almost daily in the past 3 months. So you're talking about 20 or more times in the last 30 days. You know, what does that do when you're taking courses, when you have to get up and go to class? What are some things we look at when we're talking about cannabis and harm reduction? For me, a big one is no use before age 25. And I believe the drinking age, the smoking age should all be 25. That's when the data shows that the brain is almost fully developed. We should have some product education if you're going to use and you're over 21. You should discuss use with a doctor. Nobody is going to turn you in if you talk to your doctor about using THC or CBD. Those days are long over. We should use science and not scare tactics. Again, meeting people where they are. Consider the potency that you're using. Do you want to start off with a 90% THC potency or a 20% or a 12%? There is some research going on around medication-assisted treatment for cannabis use disorder I'm going to talk about. Utilizing a licensed retailer as opposed to getting products in the black market, I'll also talk about. Safely storing your products away from kids and do not use in front of your kids. Be aware of drug interactions. And also being honest with medical staff. Again, I'm always going to reiterate that with anything that I say. And also no driving. Should wait for the effects to wear off before you get in a vehicle. So we do have some recommendations, and here's a recommendation from the NIH for lower risk use. Again, avoid early age initiation of cannabis use to avoid affecting the brain. We know that cannabis can affect memory, attention, and learning. Start off choosing low potency THC or balance the THC with the moderating chemical CBD. Abstain from using synthetic cannabinoids such as Delta-8 and THCP, these new man-made chemicals that are coming out that are synthesized from hemp. Avoid combusted cannabis inhalation. Maybe change to edibles, but edibles also have a caveat that they tend to be a longer high and it's more of a head high. Avoid deep or other risky inhalation practices. Avoid high frequency use. Definitely abstain from cannabis impaired driving. And always be aware of your own personal history. Do you have a history of mental health issues in your family or dependence or addiction? And avoid combining THC and CBD with other medications or other substances. We have a great example from Canada about some safer using guidelines. Now, for those of you that don't know, in 2018, the entire country of Canada legalized cannabis for retail sale. Canada has among the highest cannabis use rates in the world. Fatal and non-fatal injuries from motor vehicle collisions, as well as cannabis use disorder, are the most common cannabis-related harms negatively impacting Canadian public health. Between 10% and 30% of cannabis users are estimated to develop a cannabis use disorder, which is in the DSM-5 Diagnostic Statistic Manual for Mental Health Issues. So the main objective for Canada's lower risk cannabis use guideline is to provide science-based recommendations to enable people to reduce the health risks associated with cannabis use. And they brought together a group of global leaders in education and science to come up with some general harm reduction guidelines. And this is a really good information sheet. It's a one-pager, and I'll share everything with IHEC and the presentation after the presentation is over. Some of their harm reduction guidelines, again, follow what the NIH is talking about. Be aware of age of initiation and affecting the brain. Get familiar with your choice of products. Get familiar with products in general. Decide what method of use you're going to use, edibles versus combustible form. Frequency of use, always consider how much are you using a day? What are some of your personal risk factors, your history of genetic history, mental health issues? Again, the driving, don't drive, and combinations of drugs are things to stay away from. So one of the things that we've done for a while in my prevention initiative is we have a key leadership team that's made up of a lot of different medical people who are actual doctors working at hospitals today in the emergency rooms. We also have a lot of researchers. We don't use scare tactics. We just pulled our data for 12 to 17-year-olds in the county, and it's showing a decrease in use over the past 14 years for marijuana use in our county. So, we put the data out as we see it. I had some people say, well, that can't be true. That doesn't, well, we use the same data sources, the chicks data, California Healthy Kids, the monitoring, the future survey, they can't all be wrong. But this is what we're seeing. Another thing I wanna, before I really dive in, bring attention to is that we've all gone to Google Medical School. And this is very problematic when it comes to cannabis. Googling medical information instead of seeing an actual doctor, and then giving that medical advice out to our friends as if we're a doctor. We either gravitate to the worst scenario or search for articles that make us feel better. The cannabis industry actually pays Google to get their information and data up to the front of the Google search. Prevention doesn't have that kind of money. So the first things you're going to see if you Google marijuana and public health are locations for dispensaries and some of the science backed by the industry. Taking medications or supplements based on Google. I just wanted to show you this case because I thought it was really tragic, but it goes to show you when you don't consult the doctor that even vitamin D can be deadly if you don't consult with a doctor and if you take too much and try to self-diagnose. This individual died from vitamin D toxicity. He had the highest possible recorded level of vitamin D in his body. His vitamin D levels to be 380, the maximum level recordable by the laboratory. So just be careful, always talk to a doctor. So my first harm reduction strategy really is do not use any substance until the brain is developed. 25 should be the allowable age for alcohol, tobacco, and cannabis. Now that's in my perfect world. I don't know if that's ever going to happen. And I'm sure I seem like a buzzkill because I'm 53 next month. And, people will say, well, 21, it used to be 18. We should really follow the science when it comes to this. It should all be uniform. The next thing I want to talk about is making sure that you are going to a retail business that is properly licensed. And the state of Illinois has a website where you can actually check the license to make sure that it's compliant with the state regulations. Why do I say go to a retail license? Well, if you use a licensed business, it is likelier that you have a product consistency, proper labeling, and the testing of the product to make sure that there's no hazardous chemicals in those products. Check the retail license again to ensure that you're soliciting a licensed establishment. The best way to get the license is to go up to the person or the bud tender and say, can I see your license, or can you tell me your license number? They should have no problem. They've jumped over hoops to get this license. We also know that the black market has not gone away, and there are still a lot of access to black market products. So if you're going to be use the licensed businesses. Here is the Cannabis Regulation Oversight Officer for Illinois. They have a great website. If you hover over the green dots or the blue dots, it will give you the address of the location. You can see Chicago has a very high density, but it's really good to see the address and the license pop up when you hover over the green or the blue. And this is accessible to anybody. I found this just with a quick Google search. We are advocating for proper health warnings and labeling, just the way the alcohol industry and the tobacco industry have proper warning labels on products. There should be warnings on all marijuana products about pregnancy, driving, drug interactions, the risk of mental health issues and psychosis, brain development, and lung health. Those are the basics. We just designed a sign for all of the retailers in San Diego. We had about 10 bullet points. 3 of them were regarding mental health risks. We know we have the highest THC potency in history, and why is that? Well, when you sell for profit, it drives higher potency levels. We also have resins and waxes that we didn't have 20 years ago. And now we have these Delta-8 man-made synthesized chemicals. And people think it's a loophole in the Farm Bill. And that's up for a legal battle right now here in California as to whether or not these Delta-8 products. Believe it or not, the marijuana industry is backing prevention efforts to limit Delta-8 because it's cutting into their profit. We have smoke shops that are selling Delta-8 and that don't have to get a licensed retailer for cannabis here. So they're actually pretty upset that the Delta-8 is cutting into their profits. I want to talk about products now. So if you are going to use, you should be aware of the differences in the products a little bit. Not all marijuana products are created equally. There is the plant matter or the bud. There is a female and a male cannabis plant. The female plant produces higher THC content buds. The resins particularly contain higher amounts of THC. Indica species tend to have higher CBD rates. Sativa species technically have higher THC. Then you should know the difference between cannabidiol or CBD and tetrahydrocannabinol. CBD has more of a sedative effect, yet it has more drug interactions with over-the-counter prescription medications. Tetrahydrocannabinol has a psychoactive effect, and you should definitely avoid driving because this can impair your senses. Then you have these Delta-8 synthesized products versus the Delta-9, which is the natural chemical. Delta-9 can also be enhanced to increase potency. You have vaping versus edible versus combustible. Now, as you saw in some of the guidelines, in order to avoid lung problems, those guidelines are saying do not combust or light on fire, that you should either use a vape or an edible. Again, vapes come with their own lung issues like E-valley lung injury, increased risk of respiratory ailments. Edibles come with their own caveat. They tend to be longer lasting. The high might not take effect for an hour or two, and people consume more than they should in that hour, thinking that they got a dull batch. So again, general cannabis information, the bud or the plant material, the highest bud concentration of THC I've ever seen was 32% in White Fire OG. But it's generally less potent than the resins, which could be upward of 99% THC. Indica strains generally contain more CBD. CBD has a more sedative effect. Delta-8 is a man-made chemical. There's nothing natural about that chemical. It does have psychoactive effects, and the effects are unpredictable because the Delta-8 has only been out for about 5 years now. Delta-9 is the naturally occurring chemical in cannabis, but it can be modified to increase potency. Edibles may be more of a head high with a longer lasting psychoactive effect. Talk with a doctor. They need to know. They're not going to criticize you. Not the ones that I go to. My doctor I've known for over 10 years. I think a doctor and a barber, not in my case, are one of those people in your life that you stick with for a long period of time because you develop a trust with them. And there are a couple of other, like your tattoo guy or somebody else. You want to stick with the same guy or girl because you have a rapport with them and you know you can tell them anything. Get accurate information from a doctor. Be aware of drug interactions and be careful of edibles. Now, drug interactions we're seeing in more of the older population. And why is this happening? You're probably saying this is a college level harm reduction webinar. Why am I talking about this? We've seen a tendency for younger people to give their older relatives advice on medicine and taking THC or CBD to help them sleep. This is causing ER visits. So avoid recommending cannabis to your older relatives to avoid harm. You don't know what medications they're on. For instance, we had a case here of an older gentleman who was given CBD by his granddaughter to help him sleep. Well, it helped him sleep, but he was taking CBD and he cut himself and almost bled out. He was on Coumadin, and CBD reacts with Coumadin, the blood thinner. He was in the hospital for quite some time. They couldn't get his bleeding under control. You got to know the risk factors. Also, older people have a tendency to fall and be unbalanced, whether it's from the psychoactive effects of THC or the sedative effects of the CBD. There is a really good drugs.com checker that anybody can use. And this is really free and it's good. Now, again, I would say consult a doctor. But remember a few other things. If you're intoxicated on anything, you're probably not going to take your medications scheduled the way they should be, or you're going to miss a dose. Remember that THC or CBD can actually enhance or minimize the effect of over-the-counter medication. So if you feel like your mental health medication is not working properly and you're trying to use THC or CBD, that can be a problem. I definitely would not suggest anybody using high THC if you have seizure disorders or mental health issues. Let's talk about these Delta-8 products and harm reduction related to Delta-8. So it's important we know what these are so we can give out the proper information. Delta-8 is made from CBD from the hemp plant. The conversion of CBD, and I don't know who came up with this, but some researcher did, using a solvent such as toluene or heptane acid. And then you get this Delta-8 product, which is synthesized, and it can be stronger than Delta-9. Delta-8 is not the only synthetic cannabinoid we're seeing. There is THCP, Delta-10, HHC, THCO. THCP, which was created by an Italian researcher, is supposedly 33 times more effective on the CB1 receptor than Delta-9, substantially increasing the psychoactive effect. We're going to be seeing a bunch of these chemicals flooding the market. So we have to be really careful of these. Now, these will not show up on a regular 5-panel drug screen. You have to order a Delta-8 drug panel. And by the way, it happens to be expensive, unfortunately, more expensive than ordering a regular 5-panel. We do have some data coming out around Illinois, Wisconsin. We had a cluster of Delta-8 issues, and the CDC and FDA put out some issue briefs about what they're seeing in some of these cases. This may also be a reason that we're seeing an uptick in poison control calls. So we are trying to work with the CDC and creating ICD-10 codes for hospitals for when people go and are admitted to the hospital, so we can better get an understanding of how this is impacting our public health. I have to talk about medical use of marijuana. Remember, there's no real difference in the product, medical marijuana versus non, unless you're talking about pharmacy accessible marijuana. There's no different farm that grows marijuana for medicine. There's no different farm that grows it for recreation. Now, if you do want to use a FDA-approved medication for seizure disorder, this is Epidiolex. You go and get this at Walgreens or Rite Aid. This is for a certain subset of seizure disorders in kids, Lennox-Gastaut syndrome. And about 20,000 kids in the US get diagnosed with this. This is actually from CBD. Now, there's good and bad news when it comes to medical marijuana and cannabis. There is a link between acute lymphoid leukemia and a causal association between that and cannabis use. And we know from the CDC, American Lung Association, and others that smoking anything is not good for your lungs. Testicular cancer is associated with a twofold risk of marijuana use. Now, that's the bad news. The good news is that cannabis and cannabinoids are being studied in the treatment of nausea related to chemotherapy and cancer treatment. Now, we know that delta-9 in the form of dronabinol and nabilone, again, prescription medications that you would get at Walgreens, are given to treat nausea and vomiting caused by chemotherapy. There is an oral spray with delta-9, and there's a study of these other chemicals in marijuana called naboximols. An extract given as a mouth spray was shown in a small randomized placebo-controlled double-blinded trial in Spain to treat nausea and vomiting caused by chemotherapy. In any of the studies that I find, and I've been doing this for 15 years, I have not found that high potency THC is an effective medical treatment for anything. Inhaled cannabis, small trials have studied for the treatment of nausea and vomiting caused by chemo. Again, I want to reiterate that I have not found any studies of high potency THC products being effective for any medical disorder. Another thing to be aware of in perspective of harm reduction is screening of all patients for cannabis use before surgery. And this is a guideline that just came out. It looks like people who use cannabis on a regular basis need more anesthesia when they go in for surgery. So let your doctor know if you're going under that you use THC or CBD. I also want to point to you again some of the medical association position statements regarding cannabis use for medicine. You can see all their position statements. This is just a handful. I would recommend that everybody read these. Like for instance, the American Glaucoma Foundation. The caveat with using THC to lessen the effects of glaucoma is you need to use it all the time in order to lessen the pressure on the cornea. So it does work, but you would need to be high all the time in order to use and have the pressure on your cornea be relieved. So some trends we're seeing in 2024 and the harm reduction strategies we're using. If you are a parent that uses, be aware of child poisonings. Please, because we're seeing an uptick in these cases, not only in California, not only in my county, but in the country. Do not use in front of a child. Some of these products look exactly like a regular Oreo cookie or a Chips Ahoy cookie. These, our kids love to mimic what parents do. These products resemble familiar brands. Kids also cannot explain what or how much they consume. Most of these, and I know the regulations are 10 milligram servings, but a small gummy, a kid can pop in his mouth 5 seconds turning your back, and he can't tell you what they just took. So these kids, unfortunately, are being subjected to unnecessary medical testing at the hospital to rule out meningitis. They're also getting radiation to rule out anything else. Here are just some studies, and what I'm going to have to do is stop sharing to turn on the video. I want people to see this, so let me see if this works here. Okay. I want to show you, here we go. I'm going to have to go through quick. I want to show you this video because it really sums up the problem of these poisonings that we're seeing.
New tonight, San Diego County's only children's hospital is reporting that marijuana products are getting in the hands of kids. And now more children under the age of 5 are landing in the hospital with cannabis poisoning. Our Sarah Allegre joins us live outside Rady Children's Hospital with more. Sarah.
Well, Kathleen, it all narrows down to edibles, those gummies, cookies, chocolates that parents may leave around the house. Well, it looks a lot like your ordinary snack to your average toddler. And once they get their hands on them, well, the consequences could be detrimental.
1 or 2 gummies that a normal-sized adult may take can actually cause a child to stop breathing.
It's been busy at Rady Children's Hospital. Dr. Natalie Lab is a pediatrician there and says toddlers are pouring into the ER with cannabis poisoning.
We're seeing 3-year-olds, 4-year-olds, 5-year-olds kind of exploring their home environment like all toddlers do, and they're finding cannabis products that look like food that they would normally eat.
Kids are now easily getting their hands on gummies, cookies, and chips laced with THC, decorated in colorful packaging, which could be deceptive to the eyes of a child. Dr. Lab says the majority of cases do occur at home and are purchased by a parent or adult in close contact.
You have to treat these like any other dangerous narcotic you have in the house, or medicine. So you keep them high, you keep them away.
Joseph Eberstein runs a county marijuana prevention effort. According to his research, countywide, there's been a 75% jump in poison control calls for marijuana-related issues since it was legalized in 2016, matching a nationwide trend following the pandemic, according to the CDC.
Now we're seeing upwards of 100 or more children every single year who come in very sick after ingesting some form of cannabis in their home.
Pediatricians say some of the effects have led to seizures, trouble breathing, and could even lead to death. Dr. Lab is helping fight the issue through AB 1207, a bill she helped write to ban THC products that could attract young kids, hoping to put an end to a dangerous and life-threatening trend.
We've tried to create an infrastructure where cannabis packaging will not be attractive to children, where it won't look like candy, where it won't look like something that they would think is safe.
Now, that bill is currently making its way through California legislation. And while many health professionals do support this bill, there are many people on the other side of this debate that are in opposition. That does include key industry players in the cannabis industry, including California Cannabis Industry Association. It's what's looking to be a good battle and fight down both sides. For now, live here in Kearney Mesa, Sarah Allegre, Fox 5 News.
Wow, some of that packaging is certainly eye-opening. Thank you, Sarah, for bringing.
So that bill was vetoed in October by Governor Newsom. He said that the bill was overly broad. Our children's hospital here at Rady's is doing a lot of research around these poisonings. So it's important to know how these kids are getting in, what products. It's mostly driven by gummies and candies. The average age of poisoning is 2. Who's marijuana gummies? Mostly mom and then dad. Unnecessary testing of infants happening to rule out meningitis and other illnesses like a lumbar puncture. CPS reports are generated for frequent flyers. And Dr. Natalie Laub, the individual you just saw, can do presentations if you would like in the future. She's an expert on child poisonings, not only with cannabis, but fentanyl. So what products are being ingested? It's mostly fruit candies, then chocolates. And then kids are getting into the vape juice. Vape juice and liquid nicotine is a neurotoxin. So even if it gets on the skin, it can cause problems. And again, kids don't know. They're mimicking what they're seeing mom or dad or a babysitter doing. So harm reduction tips: do not use in front of children. Safely store in a place that children cannot get to. Use a lockbox. Be honest with healthcare providers and call 911 and poison control. Mental health and cannabis and harm reduction strategies. It's important to know, first of all, what the ramifications are and then the harm reduction strategy. So here's another video I'm going to share about the effects of THC on mental health.
Well, September is Suicide Awareness Month, and local doctors are now coming together to inform parents about the risks of marijuana use on youth mental health.
And for more on that, we want to go now to Fox 5's Alani Latang. She is live from City Heights for us this afternoon. Hi, Alani.
Good afternoon, Andrew, Maria. And the main thing that doctors want us to walk away with is that they're saying that the marijuana out there today is not like it was a decade or even a few years ago. Experts warn it's stronger and it's getting more young people hooked with the variety of options that are out there, concentrates, edibles, vapes. And because of that, they're saying they're now seeing a link between marijuana use and mental health.
Every day I treat patients who suffer from cannabis use disorder.
We want to make sure that parents and youth are making informed decisions and understand the risks.
Doctors laying out the relationship between marijuana use and youth mental health. They warn cannabis use is a suicide risk factor for people under the age of 25, adding that cannabis use disorder and daily cannabis use were associated with suicidal thoughts, plans, or attempts in people 18 to 35 years old with or without underlying major depression. The FDA is slapping on a warning for people with psychiatric history to avoid even prescription level THC.
People who have a mental illness can exacerbate their condition by using THC.
Experts warn that THC is also getting stronger. The Department of Justice found that the average potency level in marijuana has increased from 8.9% to 17.1% between 2008 to 2017. One parent taking notice of that for his oldest son.
It's often the start of a descent into a living hell.
The parent says his son got a pilot's license at 17, had academic goals, but quickly became addicted to vaping.
And then things got worse. He abandoned college after one semester, moved back home, smoked nonstop, alienated himself from his friends, spent all his money and much of ours, and became truly psychotic.
Doctors warn the high potency THC out there is a risk factor for developing psychosis in youth.
And it can become permanent, even in young people who have no underlying mental illness.
Experts also advise not to shy away from substance use conversations, to instead have the discussion early and often with youth.
To be honest and open with your healthcare provider, if you do suspect use and your child is having a mental health issue, it's really important to have that conversation. Don't think that you're weird.
Our son is slowly getting better. Despite 9 months without weed and the same time working a full-time job.
Experts had acknowledged that more research is needed out there to really better understand marijuana use and mental health, especially in youth. But they also warned that marijuana use can interfere with common mental health medications. So that's also something for parents and for youth out there to be aware of. Reporting live in City Heights, I'm Alani Latang, Fox 5 News.
We've been very busy out there trying to get the word out. I'm not sure if everyone heard of this case. This happened last year. It was a case that was very tragic. This individual wound up stabbing her boyfriend, the dog, and herself. And her defense was cannabis-induced psychosis. Now, the thing that was interesting about this case is not that she's doing absolutely no jail time. She got no jail time for that, but that the testimony from both the defense and the prosecution are both well-renowned psychiatrists, Dr. William Wershing and Dr. Chris Mohandi. And if you want to know more about cannabis-induced psychosis, you could read the transcript. Very, very interesting. The specific strain that she was using was 31.8% THC. It did have a warning label that said caution for high tolerance users only. And then for more information on mental health and cannabis, Dr. Ranit Lev is available to do presentations. I see that I'm about 15 minutes and I have a lot more, so I'm going to go kind of quick. Harm reduction for mental health. THC and CBD can alter the effects of many mental health medications. They can cause impairment together. Being high can alter the schedule of medication, so always talk with your doctor. If you're not feeling good. You know, people are using this to self-medicate with depression. In some cases, it can exacerbate. Talk about vaping, fentanyl, and cannabis, and whether we're seeing fentanyl in cannabis, because this is really a harm reduction strategy. If we are seeing this, you want to steer clear. So some general vaping information. These products are considered hazardous waste. You shouldn't throw them in the garbage. Both the battery and the cartridge need to be properly discarded at a waste management place. I don't know if many people know that. The FDA does not currently require testing of all the substances in e-cigarettes. Are we seeing marijuana and fentanyl? I know we've seen cases or presumed cases, but we're not seeing that in large amounts. So actually, the second paragraph of this media piece says, no marijuana laced with fentanyl has been found here in San Diego County. Why is San Diego important? Because we share a border with Mexico and a lot of the cartels. We see the first products that enter the US. If we're not seeing that here, there's somewhat of an indication that's not a trend elsewhere. We also got a statement from the DEA as to whether they're seeing it. The DEA said none of the local labs are reporting that marijuana is being laced with fentanyl. We did have one case of fentanyl in a vape pen, and this was confirmed by the medical examiner who actually studied the vape pen and found fentanyl in the vape cartridge. This is a confirmed case. It was so rare, though, in 2019 that the DEA put out a special bulletin. So what do you do with a vape then? I know this is the next question. Well, our County Office of Ed developed guidelines for the safe storage and handling of vapes. And also our California Department of Healthcare Services always handle these with gloves. If you're confiscating them or if you come in contact with them, I would not take them apart. I also wouldn't group them all together in a bag because the batteries have a tendency to light on fire. Don't handle e-cigarettes with bare hands. Rinse or throw e-liquids in the sink or toilet. Don't throw any component in the trash or recycle bin. I know that some of the take-back days for prescription drugs also include vapes, so that might be a way. Let's talk about some resources. If you're not aware of this group, Isaac, you should get on their listserv, isaac1.org. They have a great medical library in terms of cannabis and what it does to different parts of the body. They also have a free webinar series each year. The last one was about drug interactions. There is medication-assisted treatment being developed for cannabis use disorder. This is really interesting drug, which actually reacts on the CB1 receptor. It's called AEF0117, and it appears in trials to counteract the high associated with THC without disrupting the receptor's physiological and behavioral functions, which include memory, learning, emotional process, and sleep. We recently did a ABC 10 three-part investigative series with Jim Avila about poisonings, mental health, and packaging. That's located on our website under this link. And the rest of my slides are going to be designated for driving, because this is an important thing to remember with harm reduction. We are lucky to have this UCSD TREADS training, research, and education for driving safety here at the University of California, San Diego. They have come out with some recommendations regarding cannabis and driving. The first big one is do not drive until the effects have worn off. Now, this is tough if you're, having a psychoactive effect and you're trying to make a proper decision. So if you're around people or if you're a friend, let them, tell them not to get in a vehicle. There is an online safe driving course that they developed. This will be in both English and Spanish. It's a 40-minute self-paced course. And the thing I like about this is that it really does discuss cannabis. A lot of other safe driving programs don't talk about cannabis and driving. Alcohol and driving, yes. They also talk about polysubstance use, which is really driving our DUIs locally. They talk about DUI laws. Your first DUI is going to cost about $13,000 in legal fees and fines, which tends to scare people away, which is good. Sometimes those tactics work. And other DUI laws. You can find that here on these links. They also developed tip cards. The tip cards are pretty cool because they talk about safe driving windows. Like I said, the first safe driving windows is not used until the effects have worn off, but inhaling cannabis, you should wait at least 4 hours to drive. Wait at least 8 to 10 hours to drive if you're eating an edible. Harm reduction resources for everyone. There is an Illinois Harm Reduction Coalition, the National Harm Reduction Coalition, 988. SAMHSA has a national helpline, and these are all more resources. Some other coping tools that I talk about, because listen, if you're going to try and steer people away from using something that they have been using for 10 years, and it takes up most of their day, you have to replace that time with something. You can't just leave people who have been using 8 to 10 hours a day with a big gap with nothing to do. So exercise, get a pet, have activities, speak with a professional about how you're feeling. Give yourself a break from use and see how you feel. Taper down from higher potency to lower potency. Have a daily routine. Get enough sleep. Actually, higher potency THC can affect your REM cycle of sleep. You don't get a deep enough sleep. This is for younger people. No is a full sentence. If you're offered something, especially now that we have fentanyl laced and meth and cocaine and all these other substances, tell them you get drug tested, you have a medical condition such as asthma, you can't smoke, or just tell them you want to remember the good times you're having. We do have active social media, and we also offer some social media support if you need any. We're active on YouTube, Facebook, Instagram, X, and LinkedIn. And we just redid our CCR website. We have a ton of information on here, as well as our own public health resource library, all of the drug driving resources. And we have about 9 minutes left for some questions. So let me stop sharing. I know we covered a lot of base. Does anyone have any questions? I see a couple of hello, is that Christine?
How are you?
Good, how are you?
Good. I am on the East Coast and work in the prevention field, but I also teach as an adjunct with college students. So a lot of the norms that you're sharing definitely see, and I mean, two different target populations, but I was curious just with especially seeing the parent piece, because in the community that I work in with a nonprofit coalition, we see a lot of alcohol use is a really more than anything else with parents. But I do think that the marketing for edibles, especially in marijuana, is so strong. Like even me myself as like a midlife mom, like I get on my Instagram feed like these out of office gummies and these buzz drops to put in drinks. And it's interesting because the marketing that they're using is saying like, don't want to have that nightly glass of wine, put these buzz drops in your evening tea. So it's kind of almost saying like, this is safer, better, no hangover with a buzz instead. I was curious because you are seeing all these poisonings and things with young kids. Do you have like a formal campaign or something that you use with parents to try to promote responsible use, kind of similar to how we have like Parents Who Host Lose the Most for alcohol responsible use?
Yes, and one of the things we did was try to spearhead that AB 1207, that policy. We worked very well with Dr. Lau, but we are promoting safe storage containers. We have a local regional that has a Stash Your Stash campaign, which, yeah, it's pretty interesting. So,
Kind of cute.
you know, the problem too is listen, I grew up in a household where my dad was an alcoholic. I'm an alcoholic. I saw beer in the refrigerator. I wanted to mimic him. There was never a time we didn't have alcohol in the refrigerator. Now we're seeing an access point for kids is their parents. They're getting it from mom and dad. And it's unfortunate. We have parents that we confiscate a vape pen and they come to the school to get the vape pen back. They said it's expensive. We want it back. So this is where we're at right now. So yes, we are developing campaigns, safe storage, don't use. The biggest one is the unintentional medical exposure to kids, because an overdose to a kid of THC looks like either a seizure or meningitis. Meningitis involves a lumbar puncture, which is extremely painful. I did have pictures of an infant getting it, but I felt really dirty sharing that. So please do not subject your children. The doctors are not going to lock you up, but just say, hey, I had some edibles in the house. You know, maybe they got into that. You don't want them exposed to radiation either. That's a really big talking point with Dr. Laub. Some of these poor kids, one of the kids we had right after AB 1207 was vetoed. We had 5 kids at a local school. One kid was in the hospital for 2 weeks. You know, so THC is very detrimental to a young child. But yeah,
That's great. Thank you.
you got it. Any other questions? I will share my email if that's okay, Kendra, in the chat box. If anybody has a question they want to think of, I'm really big on the issue of whether or not fentanyl is in marijuana, because you could really cause a public health nightmare, you know, and I have a feeling we already have 1,300 overdoses. If we were seeing that as a trend, I think we would see 13,000 overdoses, you know, so I just don't think that's a trend. So I wanted to just be clear on that. Until I start seeing some substantial evidence of this, I'm going to keep going with what the DEA said. We're also not seeing those products coming across the border. And that's usually a pretty big indication of a trend, whether it's, you know, starting with the cartels. Now, whether they're mixing that here, I don't know. There could be, you know, somebody somewhere doing them. Anyone else? Boy, I timed that perfectly. Very happy about that.
Well, thank you to our presenter and for everyone attending today's webinar. If you have any questions, he dropped his email in the chat, or you could email the IHEC email with any questions, and we'd be happy to assist you. I will be sending those that attended an email today with a post-event survey to help us plan our next events and allow you to receive credit for attending this event. So thanks again, everybody, and thank you for attending today.
Thank you. Have a great day.